lot of improvement in my condition. I've come here for severe neck pain. I was seeing somebody else, another physical therapy. I was there for about 5 sessions, 6 sessions, and my experience at that other place wasn't very good. They weren't listening to me there. The exercises they were giving me were not helping me. Actually, they were causing more injury and more pain to my neck. So it was very discouraging. And so I went online and I did my research. I looked at all these other physical therapy places and I found Bellaire Physical Therapy, and I looked on the website, read a lot that was on there, very informative. A lot of information that really convinced me that this is a place I should come to get help. And just in the first appointment I had with Dr. Lieberman, I could tell it was just going to be a different experience. He was very kind, very caring. I could tell that he was very knowledgeable. He explained things to me very thoroughly. He actually told me what was wrong with me because I didn't know that before. I didn't know what type of neck injury I had, and he told me specifically where it was, why I felt what I felt. And after the evaluation portion of it, I was very confident that I would get the help here. And then after the few appointments I've had after then, I have just seen improvement in my pain. My muscles are getting strengthened, and that's what's helping with my neck pain. And I'm just really hopeful now, and as you can see, I am happy to be here. I'm happy that I'm getting encouraged by Dr. Lieberman, by the other physical therapists, that I will get better, and under their care I know I will, because I am confident that they know exactly what they're doing and they're very knowledgeable in their field. Dr. Lieberman and all the physical therapists I've worked with, thank you so much for caring about your patients. I appreciate it, and I know other patients, future patients, are going to appreciate your service too.
There is an example of part of the spine. The top part is called the cervical spine. If you look at it, you can see that this blood supply comes up through the cervical spine, the transverse processes, these rings on the side of the spine, and the blood supply comes up through these transverse processes and then enters into the brain. This system, called the vertebrobasilar artery, carries 11% of the blood flow to your brain. The other 89% comes from the carotid arteries. So people who are worried about going to a chiropractor and get manipulations of their neck, they're worried about having an injury to this artery. And if you look, you can see that if I push on this vertebrae, it can stretch or even dissect or cut through the actual artery and interrupt blood flow to the brain. Well, this is what happened. And this patient has a hypermobility syndrome. There are special ligaments that are in place to protect the spine from moving too far. The ligaments stop motion generally in the bones. And her ligaments were very lax or loose. And apparently the chiropractor who was treating her neck didn't check, or maybe didn't recognize that the ligaments were lax, and he did cause a classic injury to the VBI, the vestibular-basilar artery, and did cause an insufficiency. She presented to us with classic textbook symptoms. At our evaluation, I just did a standard check, and I found pretty much every symptom was positive. She had dizziness, double vision, she had a sense of numbness or tingling in her hands, she had difficulty swallowing, it was a sense of heaviness. There were other symptoms that I picked up that indicated a hypermobility syndrome, and that is essentially what we diagnosed her with. As soon as we diagnosed her with that, we were able to create a plan of care that was appropriate. She was able to have immediate improvement in her symptoms. Unfortunately, it could take 12 weeks or longer to get better, but I think she's going to do just great, and I'm glad we were able to help her.